Okay, quick start. Welcome. My name is Rachel Roberts. I'm the Manager of Community Health Engagement and Strategy at the Institute for Healthcare Advancement. This is the final session for day 2 of our conference, and I hope you had a great experience today. We have one last session with David Dillon, the Recreation Manager at the City of La Habra. Today's session, just to give you some background, is called Community Engagement, Using a Human-Centered Approach when Addressing Community Problems. And you may have heard either before the conference or even during the conference that IHA has a health literacy certificate program. And the community engagement micro-credential is just one of those 7 courses. It's an online self-paced course, as you've probably heard. And what David will do today is he will, for those of you who have taken this course and passed the exam and earned the certificate, for you, it's a review and a way of seeing the concepts and content put into real world practice. So able to provide that for you. And for those of you who haven't taken the course, it's a nice overview of all the material that is covered in that module. So without further ado, I will pass it over to David Dillon, Recreation Manager for the City of La Habra. Welcome, David.
Thank you, Rachel, and welcome everybody. I'm pretty excited that anytime I get a chance to talk about my life's work in terms of collaboration, it's always a big treat for me. You know, sometimes I don't realize what I have done naturally is you know, what I do naturally that most don't understand, but occasionally I'm in meetings and I'll sit there and chat about something in particular, and I find that they truly do not understand what essentially I've been doing for the last.
And that was one of the things that I spoke to Ms. Martha in depth. I really like her. She's a nice.
Yeah, sorry about that. I just heard someone speaking, but anyway, so my hope is that today that I will give you a little glimpse of what I've done in 36 years of service in municipal government, and how, you know, working in 2 challenging communities has allowed me to really explore these concepts, which is a human-centered approach to dealing with community problems. And so I have a few slides, not many, and I'm going to talk really about, I'm going to talk more connecting. I'm not going to read directly from what you see, and I believe you'll have an opportunity to get a copy of these slides at the conclusion. So you know, if you want to take some notes or you have anything you want to ask me, you can put in the chat box. Otherwise, we're just going to go ahead and move along. Okay. So one of the things that people have asked me, how the heck do you really, you know, create this idea or these pillars, or how do you divide the community? And really, I've come up with this concept called, it's actually called the Participant Enrichment Program. When I was at Cal State LA many years ago, and working for LA Unified School District, I was working in their basically as a teacher's assistant, but I was involved with you know, working with underserved population in East LA. And so you know, when you start serving a certain population, you kind of have to figure out what models will work or what systems you can put in place to be able to help those models work. You know that there are issues in those communities, such as, you know, housing insecurity or food insecurity. We know about, you know, some of the mental health challenges, and this has been a problem we've had for many years. So how do you address those things? That's really where I was coming from. And so what I came up with through the Participant Enrichment Program is that there are 5 pillars in every community, and it's government, it's business, it's nonprofit, and it's the business community, sorry, nonprofit, and the faith community. I'm sorry, I was a little lost there. And the thing is that it's really understanding those pillars and how they work within a community. Every community has it. I've done plenty of work across the country through my work in soccer, and so I've had the opportunity to be in different sections of the country, and every community has these things. It's to what degree. If you're in a a densely populated community, you're going to have all 5 of these things, and they're going to be very prominent, and they're going to be there in front of you. But if you're in a community where there's a lot of farmland, a lot of open space, you're still going to have those, but they're going to be far apart. And so the thing is to figure out, how do you communicate with each one of those pillars, and why would you want to communicate with each one of those pillars? Well, the concept was built around
David, it's
yes.
Michael Blair. I'm sorry to interrupt you. You have a dialogue box that's blocking part of your slide there. I'm sorry to interrupt you.
Okay, I'm sorry about that. There we go.
Thank you.
And so part of the challenge, or part of the thing, was understanding why you really wanted to pursue this and why it was important. And the thing is that there's no way that any one entity can really solve any community problem. It has to be built out of everybody taking a little bite at a time. And this is something that I understood. So part of the model is understanding that in any particular problem, you're not going to have to engage all 5. I feel that you can engage 3. And if you engage 3 in any given problem, you're gonna be able to solve an issue. You're gonna be able to address a problem using, like I said, a human-centered approach. And so, sorry, I'm keep on checking these things here, and they keep on popping up. So I want to, there you go. So the thing is that what my main focus was really coming up with a way to be able to, address these issues. And that's what I called using a human-centered approach to solve community problems. Now, when I refer to that, I don't know if you guys are familiar with IDEO. IDEO is a company that was formed by a guy named John Kelly. And John Kelly was actually a partner of Steve Jobs. And it's a program, and I encourage you to look at a 60-minute video that really describes it. And if you look at IDEO, you punch in IDEO 60 minutes, and it's really a good summary of what they do. And really what they are is they're based in Stanford University, and they focus in on having a human-centered approach to solving some of the most challenging problems. And one of the things that I give an example is like the computer mouse. He tells a story of how when Steve Jobs was developing the computer, he was approached by him and Steve Jobs wanting him to develop a mouse or something that he could use to move the cursor so that people can open up different windows. And so what John Kelly did was he brought in a group of people. I think one was an anthropologist, the other one was a business person, someone in school, there was a student, and they sat there and they looked at the problem from a human side, from what their perspective was on that particular problem, and hence they came up with the mouse. And we all know about the mouse, and we know how it works and everything, but it tells you that Steve Jobs and Apple were mostly focused on how their product can change your life. And that's really what, when you look at a human-centered approach on everything, it's about being able to influence things that will help change your life, or provide models, or provide systems to be able to help people get to where they need to go, or understand where they need, or identify what you need to help that community in a way that is more looking at it from a different objectives. The thing is that if you have a group from the same industry and you're all looking at the same problem, the likelihood is you're going to probably have groupthink. You're going to all see it the same way. You're going to come up with the same solution, or the same challenge, or the same discussion. When you bring other people into the fold, you look at things differently, because they may have experiences that you may not have had an experience, and so you're able to learn by that. And that's really what the human centered approach is all about. It's about understanding that you need to sorry, this thing is not working here. You need to be able to have a better way of looking at life, at the things that you need to focus in on. And so what I'm going to talk about is a couple of models that I work with, our case studies, and that's what the next slide is. And this I'm going to spend a little time on, because I think this really encapsulates what I'm talking about. And it has to do with Move More Healthy campaign. When we were faced with some challenges in 2006, and this is in La Habra, in 2006, And we knew that in order for our department to survive, because I work in community services, we were going to have to change our model. And so what we looked at was what we can do to help bring more people into helping to serve our community. And so we were running programs, special events, and and it required labor, it required staff. And so I had this idea, and the idea was to we need to build a healthier community. So why don't I just engage all of the health providers in the city and bring them into a room and see if we can come up with a solution. And so I did. I drafted a letter, invited 9 different agencies to come and visit with me and talk about health. And so they ended up showing up, which was a little bit of a surprise to me, and all 9 of them showed up. And so I went in there and I realized that, I'm a recreation professional who has been in recreation for, at that time, probably 25 years. I knew the only thing I knew about health was really the fact that I went to the doctor. And so these professionals that I had in there, they saw health in a much different way. And so our first couple of meetings were kind of getting to know each other. But then I knew immediately that I needed to produce something that was going to bring them together. And so hence, at that time, Michelle Obama's Move More Yet Healthy initiative, our campaign, started to gain momentum. And so I started working with Providence St. Jude's, a gentleman by the name of Barry Ross. And I brought up the idea is, why don't we come up with our own Move More Yet Healthy campaign? And so we started discussing it. Everybody liked it. And so we all thought that this was a good thing. And what it came down to is what is it that we want to do in terms of building a healthy community? Well, we were fortunate enough that our county produces an annual, or actually it's ever done every 2 years, a report called Orange County report on children's health. And so it broke down every community on where they were health-wise, and broke it down to really just at very, very ground level information. And so what we learned were 3 things that we had a challenge with. Number one, our 4th graders had the third highest obesity rate in the county. That's against 34 different cities. Number 2, we had the highest rate of teenage pregnancy. I think we were like number 4 or 5. And then the other one, which was critical to our law enforcement, was that we were number 4. I remember this in juvenile crime. And so we knew that when it comes to moving more, eating healthy, that's one element of it, but it's actually building a healthy community. And so what we ended up doing was pulling all of our information together and drafting a Move More Yet Healthy initiative that turned out to be, I think it's a 30-page document that breaks all these different activities down. First, it provided an executive summary of what information was available at the time about our community. Then it talked about the different things that we can do to help address those things. And so at the end, we ended up producing this document, and it went through 2014, or actually 2015. And so it did 2 things. Number one is it enabled me to be able to not only bring that group together, the group ended up expanding to 40 different agencies. And then we ended up forming 3 other committees out of it, which was Senior Advocacy Committee, which had membership of about 15 or 20, I can't remember the number. We had Teen Advocacy, which was a much smaller committee. And then the last one was we had the Collaborative, and that turned out to be its own nonprofit eventually. But the most important thing that we found was we were able to bring everybody together. And not only could we bring them together to address some of these health issues, now each one of the entities that were involved became investors in it, not only from from an information investors, but actually invested resources, including money, into this campaign. It was such an effective program that without normally, whenever the city adopts something, you have to go through a formal presentation to our city council, and then it gets approved. This is the only program in the 24 years I've been here that's ever been just embraced by the city council. And so it made us realize that we ended up not only pulling together a campaign with a roadmap on how to build a healthier community, but also enabled us to be able to bring not only the health agencies involved, but when you looked at the portfolio of people that were involved, they represented the nonprofits, they represented the faith community, they represented every one of the pillars, because every one of them could benefit by being involved with this program. And so we ended up revisiting the campaign again, and it was reproduced in 2015 and extended into, went into 2019 by the time we got it done. And now it's for 5 more years. So it goes into 2023. And I put down that today the Move More Eat Healthy is embedded in the community fabric, and that's exactly it. But again, if you look back on when I talked about the pillars, the thing is that the only way we can come up with this is if we had engaged each one of those individuals from those industries. But we had to have something that really brought them together. And when you look at the ways that the things that you've learned in your certificate program, you're gonna need to really finally identify where the challenges are in your community, and then be able to look at what things or who you need to pull together in order to address some of those problems. And this is something, like I said, I've done this naturally, but it just simply made sense. And so we're pretty proud of this, and we know that this is going to continue for many years. It has helped us with numerous grants. It helps us with OCTA, which happens to be the Orange County Transportation Authority. Whenever we submit application for funding to make road improvements or to make improvements to bicycle paths, we actually include this Move More Eat Healthy campaign initiative as part of the grant package. And almost every time the reader reads it, we get a call back saying, how did you guys get to this? And when I explained to them the same process I explained to you, that it really makes sense to be able to do these kinds of campaigns, because it helps bring the community together. And hence is the reason why having a more human-centered approach to drafting this document, meaning getting everybody involved, including the community, the residents of the community, and allowing them to read different sections. What it does is it puts their DNA on it, and how that helps in so many other ways in terms of being able to communicate different messages to them. You're going to get a copy of this at the end. There's more of a summary of this particular case study. You're going to get a copy of it, and that'll help you better understand, what we were actually doing. And you can always reach out to me, because I can share with you more information. But this is an example of how having a more human-centered approach to addressing community problems is much more effective, because it's more long-lasting, because you've already stitched it in the DNA of the audience you're wanting to serve. So I'm going to go to the next slide here. Sorry, I'm going to use my little silo. So here's a couple of the things that we ended up benefiting by. Had the committee members were 27. We had 17 local regional service providers, 2 school district staff, 2 city staff, and 6 business owners. Pretty diverse group. We're pretty proud of that. And like I said, it engaged the various pillars. Another one that I want to talk about here is the community food giving program. This is one that's been a long journey. And one of the things that did happen here, and you can see some of the information that we found and that I made reference to in the Orange County Annual Report. The fact is that there are a lot of reasons why a community does have some of these challenges. Ours happens to be that we have a very diverse group here that's largely Hispanic, who in many of our spaces still eat the traditional cultural foods using the traditional cultural ingredients. And so what it produces is a high obesity rate. Amongst other things, we have high hypertension, high blood pressure, and a lot of the other things that come associated with eating foods that are not really healthy. The other thing and so that became really important to us as we start to evaluate the need for the community food giving program. The other thing, and I want to make reference to this, is that 80% of our students qualified for either reduced or price or free lunch. That's critical to know in your community, because that information will help you better communicate the needs in your community, or the needs in the places that you want to be able to be able to provide this kind of program. And so what led up to this program, and it's not on here, that I actually began this journey almost 15 years ago. And what had happened, well, what was the conditions here, were that we had 3 different food banks that were working independent of each other, and they were working in silos. And it was the food they were getting was mostly canned goods and dry goods. And here we had a high obesity rate, and we had high diabetes rate, and we were feeding people that needed the foods that were actually contributing to that problem. And so trying to work with the groups the last 15 years was very difficult. I gotta admit, it was very challenging. But it was amazing that that the year before the pandemic, we started to make some inroads. And so I remember it very, very good, I remember this, the month in October, just before the pandemic, the group that was actually working against us really collaborating together or consolidating all the programs, finally gave up and left. And they decided, I guess they figured that we weren't going to go pull it together. And we had a group of maybe, I think it was 6 people that decided to serve on that board. And they really pulled everything together, and then was able to put together a very effective way of distributing food. And we were able to secure some local partners. One of them was Sam's Club, which was the warehouse that provided food to the restaurants, because they have 2 different ones. And then also Costco. And then we ended up working with Sprouts, which is a local grocer here. And then also we worked a little bit with Vons. And then we worked with some of the smaller shops here. We decided that we were going to open, never forget it, January 7th, 2020. And we did. We ended up opening operations. And at that time, they were maybe serving somewhere around, I don't know, 50, 60 people a week. The pandemic hits, and then boom, man, we were getting hit 2,000 and 3,000. And at the time, we had already developed 18 different partners, and we're receiving anywhere between, at that time, 4 to 8 pallets of food a day. And the food we were receiving wasn't food at the end of the lifespan. It was food that was either didn't meet the specific requirements that particular store had, and I'll explain a little bit about that because I think it's critical to understand. Or they had a sale and they didn't sell as much, so they wanted to get rid of what they had to make room for another sale they were going to have. We were getting T-bone steaks, porterhouse steaks. We were getting fresh vegetables of all kinds. And we do still today, fresh fruits. And so the quality of the food actually rose to a point that we were no longer giving dry goods or canned foods anymore. Because the main thing we want to do is provide food to this targeted population and be able to feed them better food, and hence would reduce the obesity rate, reduce some of the other causes of hypertension and diabetes through the food. And so today we receive anywhere between 8 and 12 pellets of food a day, and we have to get rid of it because the next day we're going to get 8 to 12 more pellets. We now have increased distribution around the town because that was the main thing, was that distribution was really the real critical part. And so as we assembled everybody together and we started working collaboratively with all the groups, we now have a consolidated approach to feeding our seniors through Meals on Wheels, through the CRCC, which is a community resource center, which is people can walk up and get food, and they can get 1 box of food a week, which is customized to the size of your family. So if you have a family of 2, you get enough for 2. If you get a family of 10, you get enough for 10. And imagine these boxes of food that you probably buy at the Costco warehouse or Sam's Club or any kind of big box retailer you have, but they're getting it for free. It's not costing anything for them. They basically have to show a need. They need to be able to register with the program, and hence they end up with getting healthier food, which I believe is anywhere between, I don't know, $150 and $250 a week. And so the strategy that we have as it represents not only the quality of food, our hope is that the money that they're saving that they don't have to use to pay for food, that they're using to pay for utilities, or they're using to pay for other, their housing, their rent, using it for other essentials. And so really the design of the program is being able to really expand its reach into other areas of the household. That doesn't happen unless you have a very collaborative approach, and it doesn't happen unless you engage other industries within your community. And what you'll find is that not only are you going to get food from these retailers, but we got a program called Gleaning. And Gleaning is a program that is where we have a community up here that has nothing but, used to be nothing but orange groves, avocado groves, they have lemons, they have all sorts of fruits and vegetables up there. We have a young lady that's actually a senior at the high school, and she organizes a group and they go and pick all the fruit. Then when it's ready and they come and bring it down, they don't bring it down all at once, they bring it down as needed. And so the people who need the most nutrient food are actually getting the freshest fruits and vegetables we have available to them, which is a stark contrast of what it was before. So it really is, that only happens if you have experts in the area or experts in the industry that help you build that kind of program. So we're pretty proud of what it has done. And I'm gonna go to the next slide here. And you can see here that, I talked about the La Habra Meals on Wheels. It went from 30 people that we served daily to 92 is what we do today. Park It Market, which is another one where it's a mobile grocery store. They actually come and they pick up food. During the pandemic, we were normally serving 70 a week. They picked it up, and we ended up having to transition into a delivery service. So we were delivering 140 boxes of food a week. And here's some more information in regards to the things that I talked about earlier. But the key thing is this is all volunteer driven, because even there's no way the city could afford to pay for this. It could be very expensive to pay for the food, especially the kind of food that we're getting, and then also the labor involved with the program, with being able to deliver the food to the individuals or to the families, or organize the pallets so that it is an organized distribution program. And so you can see that really what it really comes down to is bringing people together and being able to understand that you need to do that. And so again, going back to the human-centered approach as it relates to these community food giving programs, or even the Move More Eat Healthy program, I always say to people, the most important thing you have to do is first you got to inspire to people to want a part of an initiative. And you'll hear me say once in a while to the people I'm responsible for, is I'll say, I'm going to make them want to be a part of this. That seems kind of bold to say, I'm going to make them, but it's not like I'm going to force them. I'm going to put so much information in front of them. I'm going to make them feel so good about what they're doing. They're going to want to be part of this. And so what I'm looking for is I'm looking to get them to really feel the compassion involved with creating these kinds of movements. And it can be applied in any kind of setting. I use it for, I built a park. I built a series of, I shouldn't say a soccer park, using this model, completely, working with a volunteer group to lay, I think it was about 200,000 square feet of sod. And I wish I had a picture of it. You would look at that and think that a contractor did it. No, it was all done by volunteers. The other thing is, I want to say that, you have to make sure the effort is relevant to their employer. And what I mean is that if your volunteers are primarily people that are doing it as part of their work, you want to make sure that the employer knows that the intent of whatever it is you're doing is really designed to be able to serve people. I used to have this conversation with the faith community all the time. And you talk about a group that's really hard to work with. They can be very protective of their space there. And I remember bringing them in, and this was around the same time, 2006. And they showed up too, just like the health providers. And when we were putting together Move More Healthy Committee, I didn't know what I was going to say to them. But when I walked in there, I said, listen, your church members are our citizens, and you guys are the purpose of a religious institution is to serve people, and so are we. So let's look at how we can serve people together instead of being individual or working in our silos. And so the thing that I'm saying is that you really got to make an effort to make sure that you are communicating that information to their employer, to the people that are responsible for the things that they're doing. The other thing that I want to say is that you got to have ways to be able to exercise, have an exercise that brings people together. I write that down. And one of the things I do want to talk about, and we'll get to some of your questions because I can see that there's quite a few questions there, is that, with the Move More Healthy initiative, you can see how it brought people together, and through the questions you have, I'll probably provide more information. Through the community food giving program, the same thing. But for those of you who don't know about Kaboom, it's a playground build, and Kaboom is a national organization, and they are tasked, their mission is to build a playground within walking distance of every child in the United States. And so they are based in Washington, D.C. I got to know them in 2005 because we were awarded a playground build. And what you do is you fill out the application, you send it in, and I think at that time it was like you give $7,500, and they literally come with a full playground. The only thing is that it's all built by volunteers, between 400 and 500 volunteers. When we did the first one in 2005, I immediately saw that what it does is not only brings people together to build a playground, but it gets their DNA on that playground. And if any of you have never seen a playground build, please go to kaboom.com or go on YouTube and look up Kaboom. You can look at Kaboom Corona Park. That's one of the parks we did. And you'll see an open space transition into a play space, a very nice play space. But we've done 7 of these playgrounds, and all 7 of them that we've done since 2005 has the least amount of vandalism. And we attribute that to the fact that the people that built the playground in 2005, one in 2006, I think we have one in 2008, I think we did one a couple of years ago here. They still come back and see how the playground's doing. And they sit there and talk to the people and say, I helped build this playground. And so those are the kinds of things that really help build community. And the more and more you do that, the more and more, you're able to influence a change in the community. And that's what this is all about. When we look at the problems we have, it really comes down to, and why this initiative was so important, why I decided to take on this task, is because, you know, things that happen in the place that you work, or the place that you live, or in the community that you serve, it's all as a result of the subcultures that influence the culture. And if you are going to make a change in that culture, you got to influence a change in the subculture. And so these different projects that we do, these different initiatives that we're doing, are all designed to have immediate interaction with people. And as you begin your journey to produce a program that you want to use to serve a segment of your community, you need to be able to engage and get champions out there, because you can't do it by yourself. And that's the one thing, is that when you look at, when you ask me, how did you do it? Well, I didn't do it. What I did was, influence the setting so that it can be done. And the things like the Kaboom Playground Build, or the Move More Healthy Initiative, or the Community Food Giving Program, what I did was I just went out and said, okay, I think this might work. I wish I could say everything I do works. It doesn't. But the ones that do usually hit a home run. And of all of these programs here, which I began many years ago, when I leave, when I begin my new journey, going in a new direction, I have no doubt these programs will continue. There'll be new people, there'll be new ideas, there'll be new companies involved, or new partners, but the spirit, or the intent, or the cultural behaviors that cause these things to happen will all be in place. And that's what really makes working in this kind of collaborative approach makes it really exciting. Because I remember one day I was sitting in my office right here, which I'm in, and I had a youth pastor that was across to me, and said to me, David, you're in a really unique position, because you can influence change from your desk. And I said, well, I wish I can say that I can, but what I say that I can do is I can, make it so that I can make it easier for people to do the things that they want to do, and things that they know that are important to the community. So things to consider when you're looking at this kind of approach. You have to look at what differentiates you from everyone else. I'd like to think that what differentiates us from other cities is the fact that we have this more collaborative approach. The other thing is, do you know your internal and external audience? That is really important. You got to know the people you're around. You got to know them from a perspective that that is unique to your needs, or to the needs of the community. So you really got to know your audience. Can you mobilize people? I know that some of you might think, I can never bring people together. You'll be surprised. Look at the times that you are at an event, or you're at a party, or you have something where your people are listening to you. That really was what it comes down to, is really being able to mobilize people. And I got to tell you, this is the one that's really important. Are you a trusted voice? I mean, the one thing about this whole business of collaboration, the reality is that people are going to look at you and wonder, can I trust what you're saying? Do I believe in what you're saying? And, the fact is that's a reality. And you got to ask yourself that real question: am I a trusted voice? And that will help you better see, whether or not you can accomplish this. It has been a life's journey for me, and it's been great, and I've had a really good time doing it. But it's only effective if I have other people that are helping me do it. And that's the thing, is that I feel like we have a lot of champions in this city. The city I live in, which is a neighboring city in Fullerton, I'm beginning to do the work there as well. But what I'm really happy about, and I didn't share with you as much earlier, is that I've actually served on 2 national committees for U.S. soccer, and then also for U.S. youth soccer. And I've applied these same principles all over the country, building soccer fields, building small-sided pitches. So it isn't something that's just unique to the health and wellness of people in terms of in terms of the just the medical side or the dental side or the mental health side. It also applies in these other things which are your built environment in terms of mobilizing people. As I said, we literally built a soccer field, a large soccer field, using this model. So I'm going to look at some of the questions we have here, and I'll try to do my best to answer as many as I can. Let me look up here. So it says, any suggestions on how to start a food pantry in a hospital for community and low-income patients through your medical prescription program? The best thing I could recommend is gather partners. That's the key thing. As I mentioned before, when you gather people together and you say, hey, listen, I got this idea. How do you think we should do this? You'll be surprised how many people will come up with solutions, but bring them outside of your group. Don't only use the people within your sphere of influence, which is in let's say your department. Go outside your department and try to figure out who you think can be what I refer to as non-traditional partners. Bring someone in that you think is so far out there that they can never really contribute to this kind of program, but if their heart's in the right place, you'll be surprised on what they can offer you. So my thing is, going back to what I said before, bring in a group that you think can help you get to where you need to go. That would be my best recommendation. Let me see me go down here. Okay, so the next one says, I have a lot of thank yous. Got the reference to the box. Okay, got to receive that. Give me 1 second. Okay, I did answer the food pantry one. Okay, so the question was how can churches work with you to get food? The thing, let me tell you a little story about churches, and this changed my whole perspective on them. I always loved churches. I went to a Catholic church when I was growing up, and then later went to Christian, but we're all focused on a higher being. But here's the thing about churches. I did an event, and it was a very large event, 4th of July, and the church decided that they wanted to perform at it, and I said, sure, we'll go ahead and do that. He says, well, we want to do a whole theme around patriotism, and we're going to have a orchestra. So I said, fine. And so the event came. I had 5,000 people out there, and everybody's having a good time listening to a top 40 band. And then it's time for the church group to come in. I said, oh my gosh, what did I do? Is this going to work? And I just had faith. They went up there and they organized themselves, and there was probably about 60 or 70 performers up there, and they were fantastic. They were wonderful. I couldn't believe it. So I went up to Elaine Friesen, who was the pastor. I said, you guys are great. She goes, I hope we are. Most of them were part of the Orange County Symphony that happened to go to that church. And so they ended up bringing almost the entire group that performs at one of our performing arts centers to come and perform at our 4th of July. I learned then that I no longer look at churches as just church members. They're CEOs, they're business owners, they are skilled people, they're labor workers. It's just made up of a lot of different things and different people. And you have to tap into that. The question is here, they're distributing food, but it's not, they struggle with the quality of food health-wise. That's the same struggle we had here. When you hear people talk about that 40% of our food gets thrown in the landfill, that's true. For those of you that live here in Southern California, I encourage you to go visit. They can do tours. They give tours of the Second Harvest Food Bank warehouse. That warehouse is as big as a Home Depot, and they have a freezer that's probably or refrigeration that's probably half the size of one of the Home Depot stores. They get food every day, and they're not even getting 20% of the food. The rest of it is going in the landfill. The thing is that food, and here's another example here. That food, we had Costco deliver us once a whole pallet of watermelons. And they were good. They had just gotten them delivered. The problem was the Costco requires a certain circumference of the watermelon, and it was a 1/2 inch off. Because it was a 1/2 inch off, they had to reject it. and so it just came to be sold like the next day, but they didn't accept it. So it ended up being in our facility. So if you're living in a community where you see a big box warehouse and you don't, and if you have a big, like a Second Harvest Food Bank, which is a collection group or a procurement of food, work with them, because chances are they can't reach every store, and the stores, because they have a turnover rate of like 2 days. And so if they can't reach the store, that means that food is going to waste. And if you work with them, you'll be able to figure out where that food is, and then be able to improve the health of the food you're distributing. So that would be my recommendation on how to be able to do that. Let me think here, see if I got another question here. Talked about the quality of food. So there's a question here about some of the neighbors that are basically running food pantries out of looks like not out of their home, but out of a collection of people. And the thing, and it talks about serving our veterans. That's a real great question. So we have here in the city of La Habra, and you can get this information on your census, we have about 2,400 veterans, and some of them are really struggling, really bad, with a lot of ailments, and they're very proud. And so you really need to identify the numbers in your group, in your community, and see what their needs are. A lot of times talking to your local post, or your local American Legion post, or Veterans of Foreign Wars, or even go to your recruiting stations. A lot of times they'll have information on veterans that are in need and just can't make their way there. Or go to your local VA hospital and see if you can talk to one of the counselors, because they would know. Because you really want to be able to serve your veteran population, because that's they've served their country and they did everything they need to do. Now we need to help them when they need help. I see a lot of things about building a strong collaborative, and the things about being awesome and that kind of thing. Frankly, I do this because it's the right thing to do. I'm not, I kid you not. It's just, to me, it makes sense. And where it comes from is, to be honest, I grew up in East Los Angeles. My mom was a single parent raising 4 of us, and we all had to learn how to wash our clothes. We had to learn how to iron our clothes. We had to learn how to cook. We had chores, but chores that we had to do, or we wouldn't have the things we need for the following day. And we were a recipient of food from the faith community, from the local church. We did get assistance from the state. We experienced all those things, and fortunately, me and my brothers and sisters were all able to build healthy careers. And the reason I do this is because, first, I know it can be done. Secondly, if I can do something to make a difference, then I will. And I think that's the thing about building these initiatives, or being able to, create an environment where you're having a more collaborative approach. I think it's really critical. But you know what? You got to be able to work with a system. And when I look at the top of my pyramid as it relates to how to build a system, it really comes down to bringing in non-traditional partners in a room to talk about a problem, to sit there and say, you know what, I don't know what to do here. Can you help me get there? Really stepping outside your group, really stepping outside of people that maybe are comfortable to you, but really can only offer confirmation on what you're doing. I think you really need to kind of step out of that and really challenge yourself to go beyond what you think your expectations or limitations are. When someone says to me, what is your advice to a community, as you leave whatever it is, I said, listen, you can do whatever you want to do. You just got to want to do it. And I really believe that if you want to do something, then want to do it. If you want to accomplish something, then want to do it. If you don't want to accomplish something, don't do it. I mean, at the end of the day, that's really, I'm a pretty simple guy with a pretty simple message. But fortunately, I've had the opportunity to build a community here in the city of La Habra of 62,000 in Orange County, which is not the wealthiest part of Orange County that you guys probably heard about. We're up in the northern part, but we sit here and we just do our thing because it's the right thing to do. You won't see any flyers about the community food giving program. We purposely don't produce flyers because we know that if people see, we won't deny anybody food. If you show up and you need food, we'll give it to you. But we're not going to produce flyers. We're not going to, be on TV. We're not going to do any of that stuff because we know that while it is really good for the city of La Habra, and this is really good for even our outlying community because we don't turn anybody away. The fact is we can't serve everybody. We can only serve who we can. And so what we want to be able to do is be able to do a good job with the people that we can serve. And so, but again, we will never, ever turn anybody away. And so, again, I'm ending a little early. If you have any more questions, I just am really, really pleased that you guys took the time to want to hear my story. I do want to say that my story here is ending soon. I'm actually going to be retiring to move on to my new journey, which is doing the same thing we did here on a volunteer basis in the city of Fullerton. Plus, I'm going to be back involved with soccer. So that is my story. That's what I presented to you. I hope you enjoyed my message. And I see, wait, I got one more message here. I hope if you have any questions, there's my information. You're welcome to email me or call me. That is my cell phone number. So I'll be more than happy to answer any questions or help you through any issues or problems or anything that you think that that you might have. Here's another question: is how to start a food pantry or hospital for a community and low-income patients. You know what? I tell you something. I work with Barry Ross at St. Jude Medical Center. I also am a board member at the local FQHC. It's Friends of Family Health Center. And what we are doing right now, and I'm so excited about this. What we're going to be doing is I'm working with the FQHC to work with our providers to identify any patients that have food insecurity problems, and then to refer them directly to the CRCC. And we would not allow for a gap to happen. So almost prescribe them food. And I think that that's really important. It also, being able to get, the providers know who those people are who really need healthier food. They know, I mean, I remember talking to one of our pediatricians and complaining that she would be doing a well behavior check on a young baby, and the older kid, which is probably 2 or 3 years older, it's in the morning, and what they're eating for breakfast is potato chips, and the mom saying, well, that's the only thing they'll eat. Well, I was a kid once, and I'm sure, my son, when he was growing up, I always say people know what they know and they don't know what they don't know. And, I knew what I should have for breakfast because my mom taught us what we should have for breakfast because we had to fend for ourselves. Today, it's a little bit of a different world, but we still have a responsibility to help people understand why good nutrition is good for health. So I would say that that really working with your providers and being able to help prescribe those foods to them, so to speak, not literally, but say, hey, you should really visit the food bank. And in terms of building a food bank, look at what's around you. And if you don't have one, give me a call. I'd be more than happy to help you understand how this can be, because it can be pulled off everywhere. I tell you, when they say they throw away 40% of the food, they really do throw 40% away the food. You just got to get it to a place where you can redistribute it. How can churches work to get the food? Same concept, no different. It's just being able to collaborate. Don't try to work individually. If you know that there's a group of people that really want to do good things, bring them into a room. That's what I say. Just bring them into a room. How fellows in your community have to show a community benefit, as David says. This is a great place to start. Oh, that's Michael. Oh yeah, Michael, he knows all about this. He's one of the first collaborators that I invited to the meeting, and he's a very smart guy. And I thought to myself, oh, I'm gonna get this guy to help me. And Michael's been great. Getting more and more messages here. Let's see here. I'm working on a low-income meal planning book for low-income people. I can share this with you or anyone else. Yeah, I would, any information would be great. You know, getting it to Michael is actually great too, because we all are looking to take whatever information that we have and be able to pull things together. And I really got to throw a shout out for IHA, not only for inviting me here, but really IHA was really behind our ability to pull together Move More to Healthy. You know, he's Michael and his team saw a vision and really embraced that vision, and probably knew more about what I was doing than I knew what I was doing, but he really helped me work my way through. So it's been great to work with him and to be able to do the things that we've been doing. Let me see what other messages I have here. Thank you very much. Oh, thank you for the retirement too. Listen, I am just about done now, so I hope all of you have enjoyed yourself. I hope I was helpful. And you got my information. You're welcome to email me or to call me. I'd be more than happy to help you. Thank you. Have a great day. Have a great conference.